So obviously, it's UnityPoint. Anyone, is welcome to the hospital. So by providing these items, it kind of gives that comfort to those individuals, and especially in behavioral health. We actually kind of, there's things that they can't have in that unit. So by providing this, it's safe, especially like, the lotion that they could have, and shampoo and conditioner. So obviously we can't just give it to them like that, so we provide it in like little cups, and then they have access to this, and it just kind of makes them also feel like caring, that we're taking in consideration their background and stuff like that. So
it's very therapeutic to the patients. It makes them feel more at home, more comfortable, because in a hospital setting obviously it's not super comfortable and homey. So this also kind of ties that in, so they're more comfortable on the unit while being there.
And now this is going to benefit somebody with texturized hair, is that right? Can you
Yes.
kind of tell me about the items and how somebody who has that type of hair would use them?
So I know like the patient that actually took one of these home explained all this to me. So these, when they wash it, this is for like tangles and stuff, so they use this first, so it kind of breaks up like all the curls and stuff and the texture that they do have, and then they can use this one once they get the tangles out and stuff, and to kind of style it. That one is it's on the bottom. What'd that say?
oh yeah, bristle.
A bristle brush.
Okay.
Bristle brush.
And then they can have these caps. Typically they're for sleeping. Some of them did just wear them around the unit, but it's to help like preserve the hair like overnight while they're sleeping, keep all the texture and stuff how they styled it previously. So then for the shampoo and conditioner, they're supposed to be made for curly hair. That's kind of the intent, so it kind of helps the curls keep their shape, and it helps them style it better to enhance like the natural texture of the hair rather than like just a generic shampoo and conditioner. And then this is leave-in conditioner, again just to help, because a lot of the curls, they get tangled very easily sleeping on them, laying on them. So this is a leave-in conditioner to help keep, again, the softness of it and to help the curls from knotting together.
And then whatever is left while they stay here, they could actually take it home. So it comes, in a little
In the bag, and
package.
we send it home with them so that they can use it as well. All the patients I've offered it to, they have been more than happy that we have gotten them. Again, a lot of them have said that it makes them feel more at home, more comfortable on the unit. They said it's a very nice consideration that we even thought of doing this, because other facilities do not have this. And so it's very nice that they can care for themselves like physically too, because then it mentally helps as well for the patient. So it's very therapeutic all around.